our emotional problems, our emotions, diseases, disorders that affect that. Those are are referred to as mental health disorders. Now, there are different types of mental health disorders. If we are to talk about the different types of mental health disorders, we will not leave this place. Can you hear me very well?
Yes, I can. We can hear you.
Okay. So there are different types of mental health disorders. If we want to talk about mental health disorders, we will not leave this place. Mental health disorders ranging from obsessive compulsive disorders, post-traumatic stress disorders, generalized anxiety disorders, separation anxiety, panic attacks. Even as simple as a panic attack, an anxiety attack can be regarded as a mental health disorder. Apart from that, we also have addiction problems. We have multiple personality disorders. We have dependence disorders. There's a whole lot of mental health disorders.
So it's a wide spectrum.
It's a wide spectrum, ranging from, like I said earlier, disorders that affect the mind, not just the mind, emotion, not just emotion, how we think, how we make decisions, our judgments, anything that affects us mentally. When we think of mental, we think of the mind. So any disorder that affects us mentally is referred to as a mental health disorder or a mental illness.
Okay. Thank you so much, Doctor. You put that so simply that anybody can understand your answer. Yes, okay, Delina, thank you. Please, somebody asked earlier if they can ask live questions. If you have a question, there's a box right there. We'll see if we have time to answer the question. If we're done answering all the other questions we have, please ask your questions, leave your comments, join the conversation, and all of that. Okay, so the first question we have here: what is the difference between stress and depression?
Okay, so the difference between stress and depression, yes, they are very, very similar. They are very similar entities, but they are actually different if you really look at it. So stress is something very natural. Every now and then, from at every time in our life or at any period in our life, all of us have gone through one form of stress or the other. Stress is perfectly natural. It could be in form of a traffic along the road. It could be an important job interview that we have to meet up with, or it could be the death of a loved one. All of those are stressful events, and when we encounter that, we are said to be undergoing stress at that particular point in time. Like I said earlier, stress is natural. Sometimes stress is even very, very good. It's beneficial for us to go through stress because, yes, it's good. Stress is actually good because when you are stressed out, you know that you're stressed out, so it benefits you. It enables you accomplish tasks, and also it also helps you to accomplish your goals. When you are stressed out, you know you have to do something. It keeps you on your toes. It makes you
Doctor, let me keep in. I completely understand what you're saying about stress because sometimes, and I say this to my friends, sometimes I don't feel motivated to achieve some of my goals unless I'm like under some kind of deadline. I'm under some kind of crunch time. That's when I feel encouraged to do those things.
Yes, exactly. So you're perfectly right. Stress is good. It helps us accomplish tasks. It helps us fulfill our goals efficiently. But the issue with stress is that when it occurs too frequently, we're talking about several weeks, several months, several years, you are stressed out, you're undergoing some form of stress. Yesterday, I was opportune to talk about stress in a live video just like this, and we were mentioning things that could cause stress. Stress could come in form of a woman who has gotten married to her husband for 5 years, and her mother-in-law is coming on a visit, and she doesn't have any child. She has not had any child for her husband. That is stress already. The fact that she knows her mother-in-law is coming, and you know what every Nigerian mother-in-law wants. You must give me my grandchild. So the whole feeling, what am I going to do? Oh, my mother-in-law is coming. Hey, I don't have any child. What am I going? She's going to call me a witch. That is stress. If it's not that, a husband who is cheating on his wife, and then has his wife on the matrimonial bed, that is stress. So cheating is stress. So if you want to cheat you are going to undergo some form of stress or the other. So you are trying
Yes.
to meet up with the demand of not allowing your wife catch you in the act
Mm.
of
Mm.
cheating on her with another woman. That is true. It doesn't have to be you seeing a lion or a tiger. Anything that makes you
Mm.
uncomfortable. But when this thing happens frequently, then it now becomes a problem and it can lead to
Mm.
long-term health problems, including depression. Depression
Depression.
is long
Okay.
lasting. Now you see the difference.
Mm.
Depression is a long
Yes,
lasting
exactly.
thing. Sometimes people who are undergoing stress, they have the symptoms of depression, but it doesn't really last for long. I mean, we are sad every now and then.
Mm.
It's not every time we're happy.
Yes.
Sometimes we're upset, sometimes we're angry, sometimes we're irritable. At other times we're happy. But when this thing now becomes so consistent that
Like it
it
happens
now
every time.
every time, every week,
Mm.
every month, every year, then it can lead to depression. And if not treated well, it can lead to very severe depression. So that is different
Mm.
between depression and stress.
Mm.
Depression
Stress.
is more serious and long lasting, and it requires long term treatment. It's different from
Okay.
stress.
Okay. Okay, doctor. Thank you so much for that. Let's move on quickly to your next question. Um, what is the relationship between dissociation and denial? Doctor, did you hear that?
Okay, dissociation and denial.
And denial. What is
Yes, I
what
heard
is the
you very well.
relationship?
I
What
heard
is the
you.
relationship between dissociation and
Hello.
denial? Yes.
Yes, I can hear you. Can you hear me very well? Can you hear me?
Yeah. Mm.
Hello? Hello? Can you hear me?
Yes, we can hear you.
Hello? Hello?
Doctor, we can hear you.
Okay,
We can
dissociation
hear
and
you.
denial. Can you hear me?
Yes. Yes.
Okay, so the relationship between dissociation and denial are called coping mechanisms. Okay, okay. Dissociation and denial are called coping mechanisms. They are called defense mechanisms.
Mm.
These are things that have been put in place either naturally or artificially, unconsciously
Mm.
or consciously. We
Mm.
adopt this mechanism in order to cope with stress. I don't know if you understand what I'm saying. There are
Yes.
coping
Yes.
mechanisms that we consciously or unconsciously put in place so that we can cope with stress or tolerate stress. So
Mm. Okay.
dissociation and denial are called defense mechanisms or coping mechanisms, enabling us to cope with stress. Denial and dissociation, they are very, very similar. They are very, very
Okay.
similar coping mechanisms, but one is different from the other, definitely. There's always a difference between the two of them. Denial is a coping mechanism. For example, your denial just means that you refuse to accept a particular situation or you refuse to accept a
Mm.
particular event. Somebody very
Mm.
close to you has died. You keep telling yourself it's not true. It's not true.
It's not true. It
Usually,
didn't happen.
we have 5 stages of death. It's not happening. It's not happening to me. You still
Mm.
find yourself in that shock. It's like a form of shock. You are still telling yourself it is not true. That is a state of denial. You refuse to
Mm.
accept reality. You refuse to uh, accept a painful event, thinking that that painful event does not exist. But one
Mm.
thing about denial is that something actually has to be happening, a recent thing. Are you understanding what I'm saying? Denial is usually something that has to do with
Yes.
a recent event. Hello? Did you get
You're saying that denial is usually
did you get
something
that?
that happens.
Hello?
It happens with something recent.
So definitely
Okay.
something that happens recently. So anybody can be in a state of denial. Any one of us
Mm.
can lose a loved one. Any of us can come in contact with a distressing situation or a very painful event. We're in denial sometimes. That's how we cope. But now dissociation is a bit more different. Dissociation is
Mm.
you are now at that time totally disconnecting yourself from reality. You are saying, I am into this. You disconnect yourself from the world, disconnect yourself from the world. It's like you're no longer in the world. Most people who suffer from depression, they usually have that element of dissociating themselves, withdrawing themselves from friends and family, not just withdrawing themselves from friends and family, dissociating them, disconnecting themselves from the world completely. And these kinds of people, you find out that they must have gone through something really, really bad earlier in life, either in childhood or if they are adults, maybe in adult, they have gone through something really, 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 really distressing.
Doctor, please, can you take that again? We didn't hear you.
Okay.
Can you take your last sentence again, please?
Should I start from dissociation?
Hello? No, I got, you said dissociation is when you remove yourself, you withdraw yourself from your friends and family. You withdraw yourself from the world, like
disconnecting.
You disconnect
disconnecting
yourself.
is the word.
Yes, okay, that's the word. Disconnect yourself from the world.
Self and the world. Okay. So I now was saying that if you check the history, if you do have dissociation problems, you find out that they must have gone through something really bad in childhood. Or if they are maybe older adults, they must have gone through something in adulthood. I'm talking about maybe somebody of 80 years or 70 years who has gone through something maybe when he was 30 or 35. Post-traumatic stress disorder. Yes, post-traumatic stress disorder. Somebody has gone through a very traumatic experience. It could be child abuse. It could be rape. It could be sexual abuse. Maybe a girl who has been constantly being abused by her father or relative or something. Something must have happened to that person earlier in life for that person to now start manifesting dissociative attitudes or dissociative characters. I don't know if you understand what. Did you get that?
Yes, yes, doctor. If I'm getting you, you're saying that these two things are coping mechanisms. They don't just come out of you. There are things that we develop to cope with events in our lives.
Yeah,
so if you're experiencing denial or you're experiencing dissociation, it did not come out. There's usually like a root cause to it. Like you said, let me just cap it off. You said for denial, it's usually for like a more recent event. For dissociation, it's probably something that the person suffered maybe during childhood, and they're just using that to cope with their trauma. That's amazing.
Yes, that's exactly. Yes.
I did not know the difference between dissociation and denial.
Denial. They are
Words
similar.
sound similar. They're similar, but it's very clear the way you have explained it, the difference between both of them. Okay, let's take another. There's two questions here that are kind of similar. This one is kind of similar to the first one, so I'll put that one. I'll say the next question we have for you is, what is the difference between depressants and stimulants?
Okay, depressants and stimulants. It's very easy.
Yes.
We can be able to, if you are really, really smart, you can even be able to tell the difference without even. Depressants are what? Things that depress you. Stimulants are things that stimulate you. If we are going on maybe 5-year-old, exactly, what an opposite, synonym and antonym and all that. If we are going to teach primary 4 students or small children, depressants are things that depress you, stimulants are things that stimulate you. But to be more specific, stimulants are things that speed up your body, speed up your brain, make you work faster. Those are stimulants. There are drugs that speed up your body, that make you work faster, that improve your thinking functions and make you work faster. Those are stimulants. And if you notice our musicians that come on stage, remember those ones that sing rock and roll. I don't want to call names, but many of our musicians, they will take some things in order to perform much, much better than they would have performed. If some of them have to take something, otherwise they won't perform as good as when they are without using or not using stimulants. So sometimes stimulants improve the way you work, improve your function, improve how you think, improve how you act. Those are stimulants. It could be in form of alcohol. Alcohol could be a stimulant. Sometimes alcohol could also be a depressant. Sometimes people take cocaine. Cocaine is a stimulant. Sometimes people take amphetamine. And people take something they call ecstasy. Those are drugs that stimulate you to work faster. And usually, if people who take stimulants over a long period of time, they are at risk of addiction and dependence, and even sometimes drug overdose if care is not taken. I don't know if you got that. People
Yes,
who
yes.
are
People that take
taking
stimulants are at risk
stimulants,
of addiction.
addiction, overdose, and dependence on this drug. Because really, when you take the drugs, you feel good. It's a sweet drug.
Hmm.
I mean, when you take a
And
drug and then you
you perform better, if it's making you perform better, you say, oh, that would even encourage the dependence.
exactly. So
Hmm.
people, even some people take these drugs before an exam. An exam, I've had even while I was in medical school, I had friends who were taking those drugs before they go in for exam, and they actually do well, even during the
Hmm.
exams. But they are at risk of depression. Now, depressants, just the opposite of stimulant. Depressant function, your thinking function. So notice people on depressants, they're acting slowly, they are dull, acting fast. They are depressants, feeling sleepy. They have this sedating or tranquilizing effect. I mean, when you take a depressant, you are now all dull, lazy, and tired, and all that. Those are depressants. Hello, Amina, can you hear me? Hello. Hello.
Hi, we had a bit of a network.
Okay, I can hear
Yeah?
you. Yes, I can hear
Yes,
you very
doctor, are you
well.
back?
Yes, I'm back. I can hear you. Can you hear me?
Yes.
Okay. So depressants are drugs that depress you or slow down how you work, slow down your thinking functions. Alcohol can be a depressant. Sometimes alcohol can be a stimulant. Some people, when they take alcohol, that's when they work faster. Some, when they take alcohol, they become uh, slower.
Slower.
Codeine is a very good depressant. In fact, very effective
Hmm.
depressant. Codeine makes people very sleepy, very sedated, tranquilizes people and makes them sleepy, makes them lazy, makes them very weak. So those are depressants. And if care is not taken, like I said, stimulants, they could lead to drug overdose, drug dependence. The same thing with depressant. I mean, something that makes you feel good. Every now and then you pop a pill,
Hmm.
you feel better. You are having this constant
Hmm.
pain at one particular part of your body because you don't want to encounter feel that pain any longer. You take a depressant that will make you sleep. You are not
Hmm.
just numbing the pain, you are numbing how you think, you are numbing your body system, which is not good. So people are at
Hmm.
risk of overdosing on codeine, cocaine, and the likes. And sometimes it can lead to coma, it could lead to death, it could lead to,
Hmm.
like we say, drug overdose. Like when we hear somebody OD'd on film,
Yes.
most of these are musicians and celebrities. You hear that they OD'd. What does that mean? They may
Hmm.
have taken either a stimulant or a depressant. And
Depression. Okay, doctor. Oh, okay, doctor. Thank you very much for that. Let's just move on. Let's move on to our next question. Um, okay, so the question is, what causes anorexia? For almost 18 years now, I have been battling with this disease. Sometimes it is constant, like every other day. Other times it might be like twice a month. What are the possible solutions to this? This person is asking what is anorexia. I understand that anorexia is bedwetting. Is bedwetting. This is asking what causes it and what are the possible solutions. Okay, our doctor has been disconnected. I'm going to wait for him to come back. Yes, for those of us that don't know what enuresis means, enuresis is basically a medical term for bedwetting. And this question is basically asking what causes it, especially for adults, because I mean, it's normal for children, but when it's showing or when an adult is experiencing this, it's a disorder. So the question is,
what causes it and what are the possible solutions. So when Dr. TM joins us again, we're going to answer that question. I saw that Hani left a question for us. I don't know if Dr. TM will be able to take this question, but hopefully he'll be able to take the question before we end today. The question is, you would like to know more about bipolar disorders. I'm going to ask this question because I'm very curious. I'm interested in knowing about bipolar disorders. I remember a movie, what's it called? This one with Taraji P. Henson. The one with Taraji P. Henson now. Acrimony, yes. I remember Acrimony, the diagnosis that the doctor gave the wife, Ataraji, was that she had bipolar disorder. So while we're waiting for Dr. TM, please comment in the comment section anything that you learned today for the first time. For instance, me, I didn't know. Sometimes I feel stressed. I feel stressed a lot. People that know me know I get stressed a lot. But I mean, as soon as it's something I can always bounce out of. So apparently, I've learned today that stress is different from depression. Just because you feel stressed does not necessarily mean that you are depressed. But if you are feeling stressed consistently, even when there's no real reason or there's no like clear source of what is stressing you, then you might want to, explore the depression side of things. So guys, please let me know in the comment section, what do you think? I got one interesting question. I want you guys to answer it. Do you think that it is possible for somebody to have a mental disorder and not know? Like, is it possible for someone to have? Please know that this is a safe space. So, okay, Dr. TM is back. Dr. TM is back. Okay, let's try and go live with Dr. TM again. We're waiting for him. Yes, Dr. Jonah he's going to appear on one of our sessions very soon, Mr. Badno. So I've seen your comment.
Okay, hi, doctor. Welcome back.
Okay, sorry. I think it's the network that is having issues.
Yes, no problem. Welcome back. Okay, so the question was, let me just read it again.
Okay.
What causes anorexia and what are the possible solutions? This person has been struggling with this disorder for 18 years, and the person wants to know what's causing it and what can I do about it?
Okay, so enuresis, like you rightly said, it means bedwetting. And enuresis is usually, sometimes when we call a condition enuresis, we're talking about adults who are still bedwetting. You cannot say a child who is bedwetting has enuresis, because if you remember when we were small children, we must have bedwetter. Me, I can remember my own. I was doing a lot of that. So at that time, nobody would tell me that I was having enuresis. But when you are an adult and you're supposed to have stopped bedwetting and you are still bedwetting, that is what is referred to as enuresis. And like the question you asked, you said somebody who has been bedwetting for 18 years, that is actually enuresis. Now, I think you asked causes, Abby, of enuresis. Is that what you said?
What causes it? The person said, what causes enuresis and what are the possible solutions?
Okay, so causes, there are different causes, and sometimes the cause is unknown. There are many conditions that we don't know the cause. But studies all over the world, researches, reports all over the world have shown some causes, genetic causes. I mean, it's a family history thing. If your mommy or your daddy or your uncle or your sibling was bedwetting the bed, then you have a chance of also bedwetting the bed. That is genetic causes. Sometimes food allergies, some allergies to food make you likely to increase the way you produce urine. And so you find out that instead of producing the urine, as in going to the toilet or the restroom to pee, you find yourself peeing on the bed because you are producing a lot of urine because of a particular allergy. Sometimes caffeine, taking coffee increases your urine production, is a cause.
Really?
If you take coffee on a regular basis, it increases your, and let's not forget that coffee makes you unlikely to sleep. Coffee keeps you awake. So if you take coffee, you find out that you are going to the toilet frequently and yet you are not sleeping. So that means for somebody to have enuresis, maybe because of too much intake of coffee, that means that person must have a sleeping disorder, because coffee shouldn't make you sleep. So if you are awake, you should not be peeing on the bed. You should stand up and go to the restroom. So that person may have a sleep disorder. There are mental health disorders we call sleep disorders. If sometimes sleepwalking, sleep talking is related to bedwetting. Sometimes other things that could cause bedwetting could be child abuse, bullying in school, because you have been bullied so much in school, you find it difficult to stand up again to go to the restroom. That becomes a psychology. You know, people who have frequent nightmares at night, instead of standing up, because they are so scared of standing up to go to the restroom, they pee on the bed, and sometimes it now becomes a part of them, such that they can't do without having without doing it. Other causes could be bladder issues, bladder problems with the bladder. There are some bladders that can take enough urine, as in the structure of how the bladder is. Sometimes the bladder may be so small. Sometimes the bladder might be so small and might not be able to contain enough urine. So if you just take a small quantity of water, you find out that you are bedwetting. Like I said, sleep disorders, sleep talking, sleep walking, sometimes bullying, mental illnesses, bullying, domestic violence can cause you to be bedwetting on the bed. Other causes could be drugs, side effects of drugs, like I talked about, could make you urinate frequently on the bed. And those are many of the causes of enuresis. So what the solution, how we treat enuresis is by, like I said, the causes are so much. So you have to, first of all, identify the cause of this person's enuresis, because people have different causes of the enuresis. For somebody, it may be a sleep disorder. For another person, it could be an ongoing child abuse or sexual abuse. For another person, it could be anything. So anything can cause. So you have to identify the cause and treat that cause. Then when the cause has been treated, then you now treat. Sometimes there's a particular hormone we call ADH, antidiuretic hormone. It is that ADH that helps you produce urine. So if that hormone is so high, it can cause you to produce too much urine. So we give drugs that will reduce the production of that ADH, like vasopressin, that will reduce the production of that ADH so that you don't constantly urinate. Those are drugs. But most times, this type of thing requires psychotherapy, psychological interventions that help you. But you have to really, really identify the cause of your enuresis. Sometimes sleep alarms, there are some sleep alarms, cognitive behavioral therapy, they work, interpersonal therapies, they work, group therapies, they work. People who have sleeping disorders, for example, if you, at a particular time when you feel that urge to urinate, there will be a connection. These are Oyibo things that have been put in place, but that you can connect yourself, that will tell you, you are about to pee, and it will wake you up instantly, and then you go to the restroom. But that is, those are more invasive things
For
advanced countries. But for Nigeria, how we tackle enuresis is by properly understanding why the person has enuresis, treating the cause, and then giving medications depending on what the person has or the reason why the person has the enuresis in the first place.
Okay, doctor. Somebody left a question in our comment section about bipolar disorders, like a bonus question. I don't know if you want to touch on that a bit before we let you go.
So what was the question? I didn't get the question.
The question was, he would like to know more about, he said, I would like to know more about bipolar disorders.
Okay, so bipolar disorder, from the way the as the name implies, bi means two, bi means two, polar means at different poles, two extremes, poles, two extremes. So what that means is that you are extremely happy at some point, and then you are extremely sad at some point too. So sometimes you are so happy, you are so excited. In fact, you are jumping off the roof. You are just in a very, very good mood, in a very happy mood. over happy, over excited.
Over happy, like extreme, not just
Extremely
happy.
happy. You will see the energy, you will see the blood rushing through the eyes will become so red, like you're on something, like you're on a stimulant, like you are somebody might, guy, you high, is there anything wrong with you? You find out that is what the person will be. Then some few minutes later or the next day, the person will not be so sad. And there are no reasons, there are no causes. Nothing actually produced. Not like he was offended by someone, or maybe something caused him to be sad. No, there's no
root cause.
no root cause. The person will just for no reason and sad at some point. So that is what we refer to as bipolar disorder. Now, it's not that somebody will be happy now and then tomorrow you are sad, that you now say the person has bipolar disorder. That's not true, because it's not every time we're happy, it's not every time we are sad. But you have to understand that it is at the extreme. Both of them are the extremes. You are very, very happy at some point. At the same time, you are very, 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 very sad at some point. I mean sadness such that you are thinking of harming yourself, or you are thinking of killing yourself or committing suicide, and then happy in which case you are having hallucinations. In fact, you are seeing things that are not there. You become psychotic. You are seeing things that are not there, or you are hearing people that are not there, or you are having delusions, or saying things that are not true, or saying things that are not normal. That's what is referred to as bipolar disorder. I see another question. Should I answer it? Okay.
Yes. Did you see that? Yes, is bipolar disorder related to PTSD? That's post-traumatic stress disorder.
It depends. Like I said, one thing about post-traumatic stress disorder, you see, these mental disorders, in fact, the way they have been named in such a way that you can understand it. Post-traumatic, after trauma, after something bad. Trauma is something that happens, something bad that happens. Like this COVID-19 going up and about now is a form of trauma, a psychological trauma for some people. So if you have gone through this, and then after the whole COVID-19 issue, you now find out that you're having certain symptoms, like you are now scared of talking to people. You can't talk to anybody again because you feel the person has COVID-19. You are now scared.
So that's PTSD.
That's PTSD. Sometimes they now develop OCD. What do I mean by OCD? You now become obsessed with a particular act. We have been telling people now, wash your hands properly with soap and water, use hand sanitizer. You now find that this person, COVID-19 has gone, as in COVID-19 is no longer happening again. Don't go pata pata, but this person is still washing hands 100 times in a
like
day.
multiple times, obsessively,
times. Like the COVID-19 is anybody that just does like this, you start running away from the person. So those are post disorders. For post-traumatic stress disorder it's related. I would say yes, that is related to bipolar disorder, because in bipolar disorder you become extremely sad and sometimes extremely happy. So the extremely sad part of it can be related to post-traumatic stress disorder. And it depends on the traumatic event in the first place. If the traumatic event was an event where something really, really fun happened, and then something really bad now happened after, it can cause the person to be extremely happy at some point and extremely sad. So it depends on the traumatic event. I mean, somebody who has been constantly abused as a child, you won't really expect the person to be happy. The person will be inclined towards the depression, the severe sadness side of the pole, which is depression, extreme sadness. But somebody who had maybe a nice time at some point, and then something that happened while having that nice time, you find that the person is still trying to adjust to that period, and sometimes it can be related. It can, but not all the time.
Not in all cases.
Not in all cases, but it's related.
So just to round up what you said, you said that bipolar disorder is when you have like extremes of
two
the
extremes
of
emotion,
opposite extremes of emotion at different periods of time. You go from high to low at different periods of time.
Very high, very low,
very high, exactly. It has to be extreme. The key word is extreme. It has to be
extreme.
Either extreme sad or extremely happy. And you said somebody asked, you said bipolar disorder can be developed as a result of post-traumatic stress. In some cases,
In
not
some
in all
cases,
cases,
yeah.
depending on the traumatic event, right?
Very correct. Very correct.
Okay. Okay, doctor. Thank you so much for taking your time to answer our questions.
No
Before
problem.
you go, before we let you go, do you have anything to tell anyone that's watching how to, just protect your mental health in this period, this lockdown period? The things that people used to do before to distract themselves from their issues, those things are no longer there. So, any last words regarding how we can we manage our mental health in this period?
Yes, it's not uncommon for people in this period now. We are very vulnerable. I mean, what is happening now all over the world is not a happy thing at all. It's mind depressing. It can depress you. All over the world, we are all at home. The world is at standstill. It can make you really, really sad. But one I always tell people is that do not allow certain things to affect you mentally. Your mental health is extremely important. I mean, this is something that is happening to everybody. It's not just you. So it's not something you should
Yeah.
take personally. It's something that is affecting people all over the world, including America, including England, Italy, all over the world is
Everywhere.
affected by COVID. So it's not
Yeah.
like it's happening to you alone. If it's happening to you, then maybe we can now say that, oh, that means you are the only one, oh, it's all me and all that. But it's a world that I'm affected, you are also affected, everybody is affected.
Yeah.
So do not allow that to affect your mental health. Stay happy. You're at home. Use the time you have at home to your advantage. Your spouse that you never see, your wife or your husband, that so far when you walk, you hardly see your husband, you hardly see your wife. This is the time now to get to know your husband or get to know your wife.
Bond. Yeah.
Gist with your husband, really, really get to know. So those of us that don't really know their husband, don't really know their wife, this is the time to get close to your spouses, your children, your family. This is the time to do that because you should use like I say, use every disadvantage, make a disadvantage an advantage, use it to your own benefits. Spend time, play games, play indoor games. You are not moving out. Yes, that does not mean that you cannot make the best of your time. Play indoor games. That novel that you didn't have time to read when you were working before COVID-19, you can read that novel. That interesting movie that you've always wanted to watch, you can watch that movie. Keep your blood at this time now. I was telling that your blood pressure at this time now, I expect your blood pressures now to be very, very good
Low.
now,
At least,
to be
or at least
stable.
average. Yeah.
So it's an advantage. This COVID-19 period now is
Yeah.
giving people a more stable blood pressure at this time because there's less traffic, there's less hold up, there's less contact with people all over the world and people in contact. You are at rest all the time. So you use this time to your advantage. Then another thing I wanted to say is Nigerians stigmatizing mental health. It's something that, yes, Nigerians are doing that, and until tomorrow, till next year, they're still doing it. I mean, somebody who we've talked about mental health disorders. Someone who has a mental health disorder cannot seek treatment. Why? Because he or she is scared of what people might say about him or her. They might say, oh, this person is crazy, oh, this person is yaba left, oh, this person, you know the way Nigerians talk. Because the person say want to see a psychiatrist or a shrink, that means the person is a mad person. So because of that, people now, because they might have symptoms of a mental health disorder, they keep it to themselves. They don't bring it out in the open. They don't tell anybody. They don't reach out to any healthcare professional or any family member or relative. They just keep it to themselves and it stays within them, and there's no help that will be rendered to them. And that is why there are now increasing cases of depression and suicide in Nigeria because of the way Nigeria
Because
has
people don't
designed
have anyone
itself.
to talk to.
Nobody to
People don't
talk
have
to
anyone to talk to. Yeah.
because of the stigmatization. In fact, Nigeria, we like to stigmatize. Even this COVID-19, the survivors of the COVID-19, I
There's
hear
already
now that
stigma being attached to
there's
it.
already stigma attached to COVID-19 survivors. They are now being stigmatized by people because they feel maybe the COVID-19 has not left their body or they are not totally fine. I don't know if you understand what I'm saying. So
Yeah.
Nigerians should stop stigmatizing mental health. It will go a long way in helping people seek treatment. And let's try as much as possible to reach out to people. If we notice anybody that might be having symptoms, we've talked about symptoms of many conditions now. So if we notice anybody that has these symptoms, let's try and reach out to these people and talk to them and tell them that we're here for them. They are not alone, and help ourselves, really. It can go a long way.
That's so true. That's so true, Doctor. Thank you so much. I know how short notice this was for you to come on and give us this your time, and it has been such a good experience. I've learned. I personally, I don't know about anyone else, but I have learned so much from this. And thank you so much for sharing your knowledge with us, for sharing your time with us. We really appreciate it.
For taking out the time to even do this at such short notice. Thank you very much, Doctor.
You're welcome, and thank you so much for the opportunity.
We
Thank
appreciate
you.
you.
Thank you very much. Thank you. All right.
All right.
All right. So it's just like Dr. TM has for a final note before we conclude. Okay, Doctor. Thank you so much. I think we can let you go now. Hey. Okay. Once again, thank you very much, Dr. TM, for joining us. That was amazing. Our second speaker, Ms. Sandra, was regrettably unable to join us today. So if you notice, we allowed Dr. TM to really give out his knowledge to us today. So during this coming week, we're going to reschedule her session. So we'll have her own separate session during this week. She still has some questions to answer for us. So hopefully before the weekend, we'll announce a date and a time for Sandra's session on Talk to a Doctor with First Metri. So for a final note, Nigeria, it is time for us to, I hope you enjoyed the show. It's time for us to stop stigmatizing mental health. We have to stop looking at it as if people that seek out mental health, we have to stop stigmatizing them. We have to stop looking at it as something bad. It's okay to care about your mental health. It's okay to seek help, because if we don't change our outlook on these things, you never can tell which one of your loved ones has these issues, and they can't open up to you just because they know that there will be stigma. So please, let's stop stigmatizing mental health. Let's protect our mental, let's say active steps to protect our mental health, and look out for those around us that may be showing these symptoms. And even for you yourself, pay attention to your mental health. Pay attention to how you're feeling, how your emotions are. Pay attention to how you're feeling mentally. It's really important, because sometimes by the time it deteriorates, just like any other sickness, by the time it deteriorates, it gets worse with time. So the earlier you address your mental health issues, the better for everybody. Once again, thank you so much for joining us. Like I said, it's going to be a weekly series. So next week, we'll have another medical specialist. We can have maybe a gynecologist. We can have, a dentist. We can have, please leave comments, send us a DM about, the specialist you want us to invite on the show next. Which topic you want us to talk about next? Send us messages. Tell us what you want to see, and we'd love to do that. Once again, thank you very much for joining us. Bye.